Each one of us has a story. Our journey has and is continuously impacting us. By listening to my guests share how they are discovering their best self, you will discover the best part of you. All right, welcome to Discover Your Best Self podcast. Today we have Dr. Jaime Middleton talking to us about some women's health. You guys, this is going to be really exciting because we're going to get real about some questions that people have.
Sure.
And she's going to tell us a little bit about vaginal rejuvenation and what that means. So Jaime, let's get right into it.
Okay.
So tell us a little bit about yourself first. Tell us who you are and where you're from.
Okay, so my name is Dr. Jaime Middleton, and I'm an obstetrician and gynecologist. My practice is here in the greater Houston area. Actually, we're in Pearland. Okay. And in my office, I have another doctor that I actually trained with. Her name is Dr. Freeman. And I think together we are providing the women of the Houston area excellent women's care.
Yeah. So first of all, how did you get into women's care? Why did you say, I'm going to be a doctor? A lot of people say that right when they're young.
Right.
It's kind of like a cliche now. I feel like sometimes like, I'm going to grow up, I want to be a doctor. But really, what was it that led you to that?
So my journey was a little bit different. When I went to college, I went to Rice University here in Houston. Houston is my hometown. Mm-hmm. I thought that I wanted to go into journalism, right?
Oh, okay.
And then I started doing some medical programs over the summer and got interested in medicine and ended up attending University of Maryland School of Medicine in Baltimore.
Oh, okay.
And when I went to medical school, I thought I wanted to do anesthesiology, right? Put people to sleep, all that cool stuff. But once I got into my clinical rotations, I really fell in love with OBGYN. I fell in love with the specialty because, you're providing care for women. I felt like I could relate. I also like the fact that you have continuity of care. You get to see the patient over, multiple visits. You can follow them through their life. You can do surgical procedures. You get to deliver babies. And you can help women navigate the changes in their bodies over the course of their lifetime. So, once I fell in love with the specialty, I knew that that's what I wanted to do. And while it does have lots of demands, especially on your time and sacrifices for your family, I wouldn't go back and change it.
Yeah. So when you say like times, the sacrifice for your family, what was it like, building? Because, you're married and you have 2 kids and you and your husband are doctors, right?
Yeah. So, I met my husband in medical school. He is actually a local physician here in Houston. His name is Dr. Theodore Lawler, and he's a family practice physician with Village Family Practice, Village Medical. But Ted and I met in medical school, and we've been married almost 12 years now.
Oh, congratulations.
Yeah, thank you. And we've been blessed to have 2 beautiful children, 2 girls, Deborah and Devin, and they're 4 and 5. It's just been an amazing blessing to have someone who's also in medicine. So he understands what I'm doing, what I'm going through, and he is my biggest supporter. And without him, I couldn't do what I do right now.
Right. I can understand that. So what does it mean to, I have a cousin who she's in OB, and so one of her things is like her time, right? And she's thinking about getting out of it just because of that. And so what does that look like for you? Like, tell us maybe what your day may consist of, especially if you have to go to delivery or whatever.
Sure. So, you try to plan as best you can, right? But when we plan, God laughs, right? So, I try to do the best that I can in terms of managing my office practice, right? So patients have taken their time, and their time is very valuable, right? So they've taken off of work or off of school. They may have arranged special transportation to come in. Maybe they have an acute issue or problem that needs to be seen that day. And so you try to do your best to coordinate your office practice with your hospital practice because there is that hospital component. Patients have surgical needs, whether that's they need a hysterectomy or they need a DNC or they need whatever procedure, or if they are pregnant, deliveries, right? And babies come when they get ready. So as much as you can try to plan around that, you have to have a very supportive staff. And I've been blessed with a wonderful office staff, a great crew, and now I have a great partner in the office with me and Dr. Freeman that kind of help us to balance, and so just it's a coordination of care between the office, between the nurses, and then of course the family support, because we talk about leaning in and what can you be as a woman and what is so hard, can you have family and work. And there are times, of course, when you're killing it at work, you feel like you're sacrificing at home, and vice versa. And I think that, like many working mothers, I sometimes have that mommy guilt. But I feel like I'm setting an example, a positive example for my children, that women can be successful, that they can be, positive role models, and that you can work hard.
Yeah.
My mother was a working mom,
Yeah.
and she set an excellent example for me. And so
Yeah, vice versa. So like your daughters, they know what you do?
Yeah, they do. They do. And they're so funny. They were talking about, oh, mommy's going to deliver a baby. And my youngest, Devin, I came home one time. She was 3 at the time. She just turned 4.
Okay.
And she was like, well, where's the baby?
Like you gonna bring
right.
I don't bring them home with me.
Right, no, right. But they do understand, and they understand what it means when mommy has to go to work or mommy has to go to the hospital, or if mommy's on a call. They're getting to the age where they can understand mommy's on the phone with the hospital. We have to be quiet or listen. But they're so cute.
Yeah,
sweet,
that's cute.
But they're my motivation.
Yeah. And so for you, being a doctor and being a business owner are 2 separate things.
Absolutely. Medical school prepared me to care for patients. It did not prepare me to run a business, right? And so there are a lot of things that you don't know. And, every day I learn. And hopefully every day I grow. But, there are a lot of things regarding the financial aspect or business management that, I did not know about.
What are the things, because some of the doctors that I know or business owners are like, it's so hard, for doctors to understand the business aspect. They just want to do the medicine. They just want to do their practice.
Right.
And why do you feel like a lot of them are like, no, I'll just go to work?
So I think it's twofold. I've worked in a lot of different practice models. When I first graduated residency in 2008, my husband was in the military at the time, and so we were stationed in Louisiana. And I joined a practice, and it was a private practice, established practice. I joined myself, and another physician joined an established woman with her group. So there were 3 of us. So that first model was private practice, and that was a big learning curve. Then that practice was bought out by the hospital, right, which is something you hear about a lot.
Yeah.
And so it was a hospital-owned practice, and so that was a different model. I've also done hospitalist work, which is where you are just seeing patients that are coming in through the ER or for emergency care. You don't have actually a clinic practice. I've worked in lots of different practice models. I think for doctors, our ultimate motivation is to provide excellent care for our patients, right? So a lot of the other stuff is periphery, and it's secondary to us, because our most important goal is making sure that our patients receive, at a minimum, the standard of care, but hopefully excellent care, and that we're addressing all of their issues. And so it becomes more complicated when you add the business component. So when you're looking at what are the costs of this, or what's covered by insurance, or what medication can they afford, what are their limitations based on their socioeconomic status. And so there are a lot of other factors that come into the practice of medicine. And when you add that business side, sometimes it can be a little bit overwhelming, because you don't want to lose focus of what you're really there to do.
Right.
We went to medical school, not business school.
Right. Yeah, I can see that. So how did you start doing the vaginal rejuvenation in, combination with doing OB work?
So, there are a lot of things that patients complain about. And as patients age, or as they go through life changes, a delivery is a major life change. There are a lot of complaints that kind of are recurrent, right?
Okay.
So one of those is urinary incontinence, okay? It's not the most comfortable thing to talk about.
Yeah.
You've had a baby.
Yes.
I've had 2 babies. I think we're both relatively young and healthy.
Yeah.
But I can say for myself, and I'm not ashamed to admit, I have had two children, and they both were delivered via C-section, but my bladder control is not what it used to be.
No, mine either. I had a vaginal delivery.
Right. And so that's one thing that women aren't often that comfortable talking about.
Right.
One, it's a little bit embarrassing.
Yeah.
The other thing is that sometimes people just assume that it's a natural process of aging, and they're they're limited in what their options are to manage it. So, their urinary incontinence models that are kind of been traditional. One is just wear a pad, right? Put a pad on, grin and bear it.
That's uncomfortable.
Yeah, I mean, it can be expensive. Women can spend, close to $1,000 a year on pads or detergents or products, not to mention the potential skin irritation from having that wetness.
Yeah.
And then with that comes some lack of confidence, right? You're concerned about odor.
Yeah.
You're concerned about leaking urine when you cough, laugh, sneeze, especially with intercourse.
Yeah.
So urinary incontinence is a big component, and it's a common complaint. Women aren't often forthcoming about it because it's been a little bit taboo to talk about.
Why are we so scared to talk about the things that we are, have issues with. We don't want to talk to our husbands or our mate or whatever about it because they don't understand. Their bodies didn't go through this crazy transformation.
Right.
And so how do you get people to get comfortable when they come in and talk to you? Because for me, I don't care.
Right.
I'm going to come and ask because if I feel like something with my body, I want to know. But what is it about women that you see why they're so nervous or scared to talk about it, feel judged? Or
well, I think it can be a little bit embarrassing, right? It's not something that when you want to readily admit, right? I think the most important thing is creating a safe space, right? This is all about confidence. This is about the woman feeling empowered and making sure that she knows what her options are for whatever her issues are going on with her body. And so in our practice, we try to make sure that we welcome the patient and we ask the question, right? Because if it's never posed to you, then maybe you feel like something is different, something is wrong with me. We ask all of these questions. Do you have high blood pressure? Do you have diabetes? What are your family histories? If we don't ask the question, they may be less comfortable bringing it up or mentioning it. But when you open that door, you allow them to then say what's on their mind.
Okay.
And the same regarding sexual dysfunction, right? So there's a lot of concern with vaginal dryness, okay? We often see that or kind of associated traditionally with just women that are going through menopause, right? The average age of menopause in this country is around 51 or so.
Okay.
But vaginal dryness can be an issue for women that are premenopausal, postmenopausal, at any age, right? And so our options for vaginal dryness have kind of been estrogen replacement, whether that's systemic therapy, which has its own risk factors, whether that's a topical cream, or whether we just tell them to use a personal lubricant when you have sex, right? So there's nothing really to kill the mood like, oh, wait, hold on, baby, let me run and get my lubricant from the bathroom, right? It's not so sexy, but we do what we have to do. And with that also comes just decreased sensation with intercourse. Sometimes that sensation of vaginal laxity that can come with athletes. You don't have to have had a baby. Anything that can weaken your pelvic floor muscles. Obviously, if you've had multiple vaginal deliveries or pregnancies, that can add stress. Being obese can add some stress to that. So there are a lot of situations in which women may find themselves with these problems, and it's unfair to pigeonhole that, oh, you only have to have had babies to have urinary incontinence. You only have to be postmenopausal to experience vaginal dryness or decreased sensation or problems with, achieving orgasm during intercourse. So really just creating a safe space for the woman where she can feel empowered, ask those questions, and then giving her the knowledge so that she can make the best decision for herself.
So what are the solutions?
Right. So that's a good question. So what are the solutions? For stress urinary incontinence, the solutions, like I said, have been just grin and bear it, wear a pad. One can be Kegel exercises. We've all heard those. You may be doing Kegels right now. I do not know. But Kegel exercises, other pelvic floor therapies, pessaries, which are little devices that are inserted in the vagina to help give some support. There are also surgical procedures or bulking agents that can be used to kind of give support in and around the urethra and the bladder. And then there's mesh placements or slings, right? All of them have their pros and cons, but there are some newer technologies being applied for women's health to kind of address urinary incontinence and also vaginal laxity and vaginal dryness. And so for me to be able to offer the patient something different that's minimally invasive, that they can, really see some benefits from in a short amount of time, I think is a great option. For the vaginal dryness, like I said before, either using a personal lubricant or some type of topical estrogen application has kind of been the mainstay.
But is this where the rejuvenation comes in?
Absolutely. This is where rejuvenation comes in. And I know there's been a lot of media attention and some pushback regarding the idea or the topic of vaginal rejuvenation or this whole idea of female genital cosmetic surgery, right? I'm not advocating that women have prepubescent looks or that your vagina has to look a certain way. I'm talking about function and confidence, right? Because this is about how do you feel and what are the limitations for you? Because if you're concerned about your leaking urine, if you're concerned about pain with intercourse due to dryness, that might change your interaction with your partner, right? Make you less confident. And that can have a whole lot of other ramifications. It can lead to depression. It can lead to interpersonal relationships. Like I said, overall lack of confidence for the woman. It also can be disruptive depending on what your type of work is or what you're supposed to be doing. If you're worried about leaking urine, say you're a performer or you're up on stage or you have to do something and you're, So vaginal rejuvenation comes in a lot of different forms. There are a lot of different products out on the market, but the one that I actually use and believe in is the Vivive treatment. So Vivive is actually done in the office. So it doesn't require any anesthesia. There's no downtime. It takes about 30 to 45 minutes. And it's an innovative technique. It uses cryogen-cooled monopolar radio frequency, which is a mouthful, right?
Yeah, I'm like, what?
Right. Cryogen-cooled monopolar radio frequency, basically to stimulate collagen synthesis, right?
Oh, okay.
So the idea is that the tissue, that support, has kind of broken down over time. And we want to cause synthesis of new collagen, right? New elastin. We want it to be healthier. And with that comes increased secretions of,
So you need collagen to help with what?
So
help me understand.
Right.
You know,
so
in layman's terms.
Right. So the idea, think about it like this. So women get facelifts, right?
Okay.
Or they get treatments to their face to make their skin look tighter, to look
Right.
more youthful. It's the kind of the same idea,
okay,
right?
okay.
So you want to help that tissue get more support.
Okay.
And that support
'Cause
of
it
that
kinda
bladder.
lax?
Exactly.
Okay, so
that's
that's
where the term laxity
okay.
comes from. And so once you regain that support and you get the tissue to do it on its own after you have the treatment, patients really see great result at 30 days and especially at 60 to 90 days.
And that helps with the urinary issue and with secretion and what, dryness, everything.
Yes.
And
So
if you want to climax.
yes, it can help because,
Okay.
you know, if you're not able to achieve orgasm because sex is so uncomfortable because of vaginal dryness, if you have increased lubrication, you have increased sensation, that's going to heighten the sexual experience for you.
Oh, okay.
Absolutely.
Yeah.
Mhm.
So, I mean, I know people are afraid and they want to know, like, oh, you know, I don't get an orgasm when, you know, I have sex. You know, I have to do other things or whatever. Why is that for women?
So I think that, you know, when you talk to a patient, you have to realize that each person is an individual, right? And what treatment is right for you or right for me may not be right for the next person. And that's where having them come in for a consultation to discuss exactly what are your issues and what are your concerns. Because for women, sexuality can be multifaceted, right? There'll be a lot of things that can contribute to how you're feeling about your body, towards your partner, and your sexual response. You know, I always ask the question, you know, are there any interrelationship issues, right? Because that's huge for women.
Right.
What's going on in terms of your confidence with your overall body image? If you're self-conscious about how you look, that can also interfere with your ability to relax and enjoy the sexual experience.
Yeah.
Also, are you communicating with your partner? Are you making sure your partner knows what you need? We have to speak up and advocate for ourselves, you know?
Yeah.
If your partner's not providing adequate stimulation to initiate that sexual response, well, I can't really help you with that. You
Right.
need to talk to,
have
to
to
him or
talk to
her
her,
about
yeah.
that, right? So there are a lot of things, and I think just having you come in to talk about what are your issues. Now, there are some situations where a patient is not a good fit for this particular vaginal rejuvenation. That will be someone that has kind of an ongoing vaginal or vulvar condition, whether that be a cancer or a chronic infection.
Right.
Someone that has an open lesion from a sexually transmitted infection would not be a good candidate for the procedure. Someone undergoing chemotherapy or radiation within the last 6 months would not be a good candidate. We usually advise that patients wait at least until they're 6 months postpartum after delivery before they do the procedure. And if you have a large metal implant device, you're not a good candidate for the procedure. But outside of those limitations, you know, the majority of women, this could be a potential option for them.
Yeah. It sounds like it's definitely helpful, especially for people who feel like they don't know what they can do. And I mean, how expensive is it? You know, if someone's like, man, gosh, I really want to get some things checked out.
Right,
but I
right.
feel like I can't afford it. Or, you know, what are the ways that people can, you know, pay for this? So I would assume it's not covered by insurance.
Right. So at this point, it's actually not covered by insurance. The Viviv company is actually undergoing a Viviv 2 trial to get additional clearance and approval with FDA for the device in the United States. It actually is approved for vaginal laxity in Canada and I think about 50 other countries, just not in the United States. In the United States, it's approved specifically for surgery and for cautery and things like that. But there are some studies. There was the initial trial that does show significant improvement in sexual function vaginal laxity for women that had the procedure done. So the cost, right? So Viviv is a one-time treatment. The average cost is about $3,000, which sounds like a lot, right, when you say it. But when you think about what you may be spending and doing over time, it's actually not that much.
And is it like upfront or can they make payments?
So patients can make payments. We also work with Care Credit, and we've
Okay.
actually had a few patients be able to use their health savings account.
Oh, yeah.
Yeah.
HSA or something. Yeah.
Yeah. So there are a lot of ways, you know. My goal is to help my patients,
Right.
you know, and if I think you're a good candidate for the procedure, we'll work with you to try to get it done for you.
Right.
Absolutely. So patients can do payment plans, Care Credit. We'll work with the patient.
Yeah. So I wanted to touch on something. I know that it's been a huge, big deal about like being on birth control, not being on birth control, right? And so, what what do you think about it?
About birth control?
Yeah, because
I think a lot. Don't get me started.
But I mean, there's been like this, this huge thing about on our ovaries and just all these things that birth control has either helped or not helped us with, and so.
Well, my idea about birth control is power.
Yeah.
It's power for the woman. Okay. It wasn't too long ago where women didn't have the right to control their own reproductive health.
Right.
And we have fought so hard and come so far, are in danger of going many steps back right now with the climate in this country. I think birth control is a tool that women can use to control their life, control their life trajectory, because an unplanned pregnancy is a very difficult thing.
Right.
You're faced with a difficult choice and with limited options, currently. And so birth control, I think, is awesome. And there's so many different options. Traditionally, people know about the birth control pill. They know about the birth control shot. But what we're really trying to advocate for are long-acting reversible contraceptives, or LARCs, right? Which give women the option for a very reliable, pretty much 99% effective rate for contraception. It only requires one positive act by the patient to come in and have this birth control placed. And those things are called Nexplanon, which is a small subdermal rod. It goes in the arm. And also our intrauterine devices. And there are about 5 different IUDs on the market. That's an intrauterine device. There's Skyla, there's Kylena, there's Liletta, there's Mirena. And there's also a hormone-free IUD, which is Paragard. And so for women, I just want them to know that they have so many options regarding contraception. And we can find what works best for you, whatever your medical history is, whether you have fibroids, whether you've had cesarean sections, whether you're 25, 35, 45.
And I guess that's been the whole, I don't know if it's an argument or whatever, like, don't do birth control, you got fibroids and all this stuff. And, and I feel like it's a lot of, we don't know the knowledge, right?
Sure. There's a lot of misinformation. Absolutely. And people love Dr. Google. I mean, I'm guilty of it. I Google when I don't know sometimes too about a lot of other things. But information is power, and so there are so many resources in the Houston area. And we, at my office at Premier Healthcare for Women, would love to be a resource to provide contraceptive counseling to let you know what's available. And I think there's a misconception that to get on birth control, you have to have an extensive pelvic exam or go through all of this. And no, that's not the case. If you want contraception, we will help you prevent an unplanned pregnancy. Absolutely. And the concerns about birth control regarding future fertility or concerns regarding risk for blood clots or cancer, we can address those issues because a lot of those answers can be patient dependent, but it shouldn't be a barrier. And I want every woman in the greater Houston area to know that they have options regarding their reproductive rights.
Yeah. No, that makes a lot of sense.
Yeah.
So tell me, I guess, what would be your favorite part about the work that you do and I guess the patients that you see?
Getting to know the patients, right? I was actually just telling a family, this is the second baby that I've delivered with this family. And she came in for her postpartum visit, and I was like, well, I guess we're breaking up. And it kind of feels like that, especially with your OB patients, because you're seeing them so regularly and for such an extended amount of time. And you're on this journey with them through this, sometimes amazing and joyful or sad and tumultuous and exciting and scary part. And just to be in the delivery room with those families, it never gets old, which is the one thing, even in the middle of the night, 2:00 in the morning, sleep deprived, upset, tired, frustrated. When you deliver that healthy baby and you see the look on the face of the mom or the dad, and just knowing that you helped God with a miracle, it's priceless. And so that's one of my favorite things, but really just developing a rapport and a relationship with the patients. I want all of my patients to feel like they can trust me, number one, that they can count on me for reliable and accurate information. And that it's a partnership, right? We're collaborating together. Now, obviously, as the physician, I'm going to make recommendations. I can't force you to do anything, but I will never not guide you in the wrong direction, right?
Now, one thing I want to ask is, and I don't know if this is a silly question or not, but
there are no silly questions, Shanice.
But I feel like this is something, especially for men, right? Who or even women who, I've had this question asked so many times, like women who haven't had babies, and men who don't understand the woman's body. Like after you have a baby, are you too loose? Are you this? All these things, but our but we have muscles.
Sure. Mm-hmm.
And so how does that work after you have a baby and then, going back, I guess, to being regular?
So, the female body is an amazing thing, and the vagina is amazing, right? It can accommodate a small human passing through it, right? We were designed to do this. And so there really is not, and I always caution patients to steer away from this idea or this ideal of what I'm supposed to be, or to bounce back. And one of my pet peeves is when, and I think the fathers say it in jest, oh, doc, can you put a stitch to make it tighter, or do this like that? In a sense, yes, I guess when you say, well, we're talking about vaginal rejuvenation and trying to tighten that tissue. But my motivation is for the woman, right? It's for what is what is making her feel confident. What are her issues? Not so much for the men's sexual pleasure or enjoyment. So if the woman has no problem, if she's fine, nothing needs to be done. It's natural. It's her body. But if she is experiencing discomfort, if she is experiencing dryness, if she is experiencing pain, decreased lubrication, urinary incontinence, then we want to address that for her and for her alone. Yeah.
The stitching it tight, does that even that doesn't make sense, does it?
No, I mean, there are surgical techniques, but that's not what I'm doing. Yeah, we're not doing that. We're not doing that. We're not doing that. We're not doing that.
That is crazy. Yeah. Okay, cool. So for you, since you've been on this journey, right? What does the future look like as far as like what you want to do in medicine and just having an effect on other people's lives in such a intricate, personal way?
Yeah, that's a great question, and I wish I had the answer. I don't know. I really enjoy what I do. Do I think that I want to be waking up in the middle of the night delivering babies forever? I really don't think so. Just because I have other priorities in my life as well. And I think just striking that balance as I get older and more mature and more confident in making choices that are strictly what's in my best interest. I think I will always have a passion for women's health. I know that for sure. And I always want to be a resource and providing care for women. I do see myself in private practice for an extended amount of time, though, but I don't expect to be practicing when I'm 80.
Yeah, I will say I've never seen an old OB though.
I have.
Yeah,
for sure.
Really? Okay.
But physician burnout is a real thing, I mean, they're like you said, all of the headaches of navigating medicine alone and trying to make the right plan for your patient because people's lives literally are in your hands.
Right.
The business aspect, the stress, home life, it can be a lot. And so, physician burnout is real, and recognizing your own limitations is important. I would love to be more involved in the community. I think there are so many opportunities to volunteer and for outreach, and there's so many different causes that I'm interested in.
Right.
I think that for me, I'd like to kind of figure out my focus and pinpoint that as the years come. Right.
Yeah. So tell me, what is discovering your best self for Dr. Jaime Middleton?
I think for me at this stage in my life, I'm 41. My children are they're out of that infancy and toddler stage. They're starting to become little girls. I think just kind of, finding that balance. I like I said, I really would like to kind of pinpoint and figure out what is going to be my goal and what I'm going to focus on outside of just my practice, right? To give back. I come from a family of very civic-minded individuals here in the Houston area, and I want to mirror that. I see, cousins and aunts and doing such great things in the community. I want to get more involved. I just have been so focused in my practice and in motherhood that I feel like I'm starting to step into that gap where I can bring in more things and take on more responsibility without feeling overwhelmed.
Right. Yeah. And for maybe like your patients or other women, how can they discover their best self as, with their health and, just being their best person?
I think that we have to advocate for ourselves. Women especially often bear the load of family responsibility. We often feel responsible for everyone else. And we're so focused on our children or our husbands or our family members, especially as women age. They may have aging parents or different responsibilities. But you have to make your health a priority.
Right.
And you have to make sure that you're doing those preventive screenings. You need to go in for your pap smears. You need to go in for your mammograms. You need to be getting your cholesterol checked or your diabetes screening. You need to try to, incorporate some exercise, right, and somewhat of a healthy diet. I need to take my own advice, but I think that we have to, at some point, to discover our best selves as women, we have to make ourselves a priority,
right,
and whatever that is for you, but especially prioritizing your health,
right,
because without your health, what else do you have, right? Wealth means nothing if you're
miserable,
right,
and in pain,
right. Absolutely. So I think discovering your best self for a woman would be, just figuring out that balance, but also prioritizing self-care, and whether that's taking 30 minutes a day and just silent time or meditation or reading a book or getting a massage or whatever it is. Just at some point, carving out that space for yourself.
Right, right. No, that makes a lot of sense.
Yeah.
Thank you so much for being transparent and giving the information that the people they want to know.
Yeah, well, they can call me, they can come see me, we can talk about it and definitely go into more detail.
Yes.
But thank you so much for having me, Shanice. This is fun.
Tell them how can they get in contact with you if they want to come and learn more about what they need, or even just general.
Sure. Yeah, because I'm a general OB-GYN. So, whether you're coming in for your pap smear, wellness exam, you've got a yeast infection, a UTI, whatever, breast concerns, pregnancy.
Yeah.
We're here for all of that.
Okay.
And so, women can find me. My office is Premier Healthcare for Women. We're located in Pearland. Our office is 10905 Memorial Herman Drive, Suite 207. Our number is 832-615-1109. And you can find us on the web at premierwomenswellness.com. The same name for our Instagram and also on Facebook. So definitely taking new patients. If you have any questions or any concerns, interested at all, if we piqued your curiosity about vaginal rejuvenation, please just give our office a call. We'd love to give a free consultation for you to talk about what your options are.
And she's my doctor too, so
yes. And I just love her.
Yeah, so she's very transparent, and like you said, full of wealth and knowledge, and don't be afraid to just ask the questions, because I think that a lot of times we're just nervous,
Sure.
Yeah, definitely. Well, thank you.
Thank you.
Yes. Thank you for listening to Discover Your Best Self. Don't forget to subscribe and comment. Follow us on Instagram at Discover Your Best Self.